The Delta variant of the coronavirus is set to become the dominant strain here in Ohio.
State Health Department officials held a press conference yesterday warning about a possible summer surge in cases. The state's positive Delta case went from less than 1% in May to 15% in June, with early data pointing to another spike happening right now. Hospitalizations jumped from 200 just 6 days ago to 288 yesterday. And the CDC saying the more dangerous Delta strain now accounts for about 58% of all COVID cases in the U.S., with 99.9% among unvaccinated people.
Look, context matters. And as we are looking around the world and around the country, we're seeing that where Delta has gone, Delta has driven significant upticks. And we know two things for sure. One, Delta is here and it is rising rapidly.
And Dr. Vanderhoff says if you aren't fully vaccinated, you should still wear a mask, especially in public.
Since the rise of the Delta variant, both the Centers for Disease Control and the World Health Organization have put out different guidelines about masking and social distancing. So we wanted to know which recommendations should Northeast Ohioans follow. We asked an expert at the Cleveland Clinic for some answers.
Right now, the CDC is not changing its guidance, still saying fully vaccinated people do not need to wear masks in most settings, even as the Delta variant spreads.
The United States is relatively doing a lot better in terms of vaccination and cases compared to other parts of the world.
But adding to the confusion, the World Health Organization is asking everyone, vaccinated or not, to keep wearing masks and stay socially distanced.
An organization that's looking at the entire world is going to incorporate precautions that involve really everything, every country together in their status.
Dr. Joseph Cabaza with the Cleveland Clinic says it's all about perspective. Almost 50% of Ohioans have started the vaccination process, which is much higher than most countries globally.
If you are vaccinated, Delta or not, you are in very good shape from being able to prevent getting COVID at all, but certainly from being hospitalized or having severe illness whatsoever.
So, if you're in Northeast Ohio and vaccinated, you're less likely to be infected or infect others, and it's safe to follow the CDC's recommendations.
If you are vaccinated and asymptomatic, it is extremely unlikely for you to transmit any kind of virus. You are unlikely to have enough of a viral load to be contagious.
But if you're traveling, especially out of the country, or spending time with a group that's largely unvaccinated, it's best to follow the WHO's guidelines and wear that mask.
I think every layer of precaution is going to really minimize the chance that an unvaccinated person contracts the illness.
Okay, so if you still have questions or concerns about the health guidelines or the Delta variant here in Ohio, you can find more information right now on our News 5 app.